have been posting a lot on Instagram recently about Cranio-Cervical Instability, or CCI, and I realized I hadn't yet done a video about my process getting diagnosed with CCI, so yeah, I'm just going to go ahead and get into that, and hopefully this will be useful to other people who are walking on the same path as me. Cranio-cervical instability is something that I had never heard of before this year, and now it is quite drastically impacting my life. So cranio-cervical instability is instability in between your skull and your first vertebrae, at the cranio-cervical juncture. So basically there's excessive movement in that area, and it can be pretty dangerous because it can lead to a host of neurological symptoms, and it also can cause compression of your brainstem, which is pretty dangerous. Cranio-cervical instability sometimes, but not always, goes alongside Atlanto-Axial instability, or AAI, and this is pretty much the same thing, just one joint lower in your neck, so between your C1 and C2, where your atlas is, and this also can cause a host of neurological symptoms, but can cause spinal cord compression, which again is pretty dangerous. So these are both really serious diagnoses, and a club I don't think anybody really wants to be a part of. So I've posted a few videos about how this year has been pretty wild for me, but I found out about CCI and AAI earlier this year when we were doing some research on a spinal fluid leak that I had. My mom had came across something about instability in your neck and was like, I guarantee you have this. And I read it and I was like, I'm sure I do. But at the time I didn't really realize how serious it was or that there was anything you could do about it. But during my process trying to get treated for a spinal fluid leak and get my Chiari malformation evaluated, I saw a local neurosurgeon, and I mentioned this to him and asked him if he would test me for it. So he ordered an x-ray. The x-ray came back and said that I had no instability indicated. However, you cannot test for instability with just a plain old x-ray. So to get diagnosed with cranio-cervical instability or Atlanto-Axial instability, you need a very thorough examination by a trained physician, and I don't just mean any neurosurgeon. I mean somebody who believes that these are real and specializes in them. They'll do some imaging. I've had a supine MRI, an upright MRI, and a rotational CT scan. The rotational CT scan is when you're laying flat on the CT table and you rotate your head both directions. That can help show if you have Atlanto-Axial instability, and it'll show what your vertebrae look like, what C1 and C2 look like when you're turning your head. The upright MRI will be with flexion and extension, so head down and head back. That can help show what your instability looks like at the cranio-cervical junction. So for CCI, it will help evaluate that. My CCI was evaluated first on a supine MRI, and then confirmed with the upright MRI. So I'm getting a little bit ahead of myself, but as I mentioned, I was told I did not have any instability based on an x-ray, which I knew wasn't how you were to be evaluated for it. So I pushed back a little bit against my old neurosurgeon and said, these are the imaging these are the types of imaging you have to order to evaluate that. And he literally told me, and I quote, "We will recommend no further imaging for you right now," end quote. So that was that, and I stopped seeing him and I found a specialist. So it took me several months to get into this specialist, who I've mentioned in my videos before, but it was a really validating appointment because I had also previously been a little bit gaslit about my Chiari malformation. And I've talked about this in other videos, but if you go to a neurosurgeon or a neurologist who is not a Chiari expert, they will tell you that it doesn't matter and it's not causing any problems for you. So I had been told that alongside being told I did not have cranio-cervical instability. So when I went to see my new neurosurgeon, when he walked in the office, my images were up on the screen, and the first thing he said to me was, "Wow, you have one heck of a Chiari." So that was really validating that, your brain falling out of your skull isn't nothing and isn't causing your symptoms. But after he kind of looked at the Chiari, he went further into my supine MRI that I had already had done, and even just from that image, he was able to see my cranio-cervical instability. So there are several measurements they can use to evaluate CCI. And from my supine MRI, we were able to see that my Clivo-Axial Angle, sometimes you'll see it as CXA, was at a pathological measurement. And explaining what these exact measurements are is far beyond my understanding or pay grade. It's a measurement of several points in your neck, and it should be at a certain level. So for your Clivo-Axial Angle, it usually in healthy people, it is between 150 and 160. Anything less than 135 is considered pathological and warrants surgery. If it's less than 135, there's a likelihood that it could be causing brainstem compression. And so from my supine MRI, we saw that mine was below this threshold of 135. So Clivo-Axial Angle is one measurement that can be used to determine if you have CCI. Another one is the Harris-Basion axis interval, which the pathological threshold is 12, and mine was more than that. So again, another measurement in your neck. I think it's more useful to pull up photos of these. So I'll try and link some photos here showing what the measurements are, because for me to explain, I don't think I would do a very good job for that. Another measurement that they use is the interval between flexion and extension on the Basion axis. So it should be about 1 millimeter of movement, and mine was over 10 millimeters of movement there. So that alone shows there's instability there when my neck is moving quite a lot further than it should. They also use something called the Grabb-Oaks measurement. The pathological threshold for this is 9 millimeters, and mine was more than that, which constitutes central brainstem compression. So those are several measurements that can be read from your diagnostic imaging to show if you have CCI and AAI. So that was read from my supine MRI. So my doctor pulled it up and was able to kind of zoom in and see all those angles, which was very impressive because I had already been to 4 other neurologists, neurosurgeons before this, and no one saw any of that. So we confirmed those findings by doing the upright MRI with flexion and extension and the rotational CT. So they all just kind of doubled down that not only do I have CCI and AAI, but that my brainstem and my spinal cord are being compressed. And not just that, but from my physical exam, I'm having a host of neurological symptoms. Cranio-cervical instability and Atlanto-Axial instability can occur from a wide variety of reasons, one of which being like physical trauma, maybe like a car accident with whiplash. They're also pretty common in congenital disorders such as Down syndrome. So there's a bit of excessive movement in the neck for people with Down syndrome, and they're also pretty popular going alongside genetic connective tissue disorders such as Ehlers-Danlos, Loeys-Dietz, Marfan's. So I have Ehlers-Danlos, so that's kind of where we're assuming that my excessive movement in my neck is stemming from. And when I had started this whole medical journey before I was diagnosed with Chiari and CCI, I saw somebody talking about having it, and she worded it as her brain is falling out of her skull and her skull is falling off her spine, which sounds so dramatic, but it really is kind of accurate and maybe a little dramatic, but painting a pretty accurate picture of CCI alongside a Chiari malformation. So I wanted to go into the symptoms of CCI a little bit. One of the biggest for me is dysautonomia. So your brainstem controls your autonomic nervous system processes. So since mine's being compressed, it is not doing its job right in things like regulating my temperature, regulating my blood pressure and heart rate. So my body's kind of in autonomic nervous system failure right now, I would say. It's just not really doing any of that stuff right. So that's my biggest symptom, and I'm hoping that is solved here soon, or at least turned down a little bit. You can also have pressure headaches from CCI. Neck pain is obviously a huge problem. You can have central or mixed sleep apnea, which is really dangerous. You can have like facial pain and numbness, tingling. Those are some of my biggest neurological symptoms, is not feeling parts of my body or having that tingling sensation. Balance problems, muscle weakness. When I first started this process, I was not having muscle weakness, but now even my own phone is too heavy. So if I'm like laying in bed looking at my phone, I have to have my arm propped on something. I can't even hold my own phone up anymore. Dizziness and vertigo are very common. Vision problems, reduced gag reflexes and reduced general reflexes, difficulty swallowing, tinnitus or ringing in the ears, which has gotten so bad for me, it's like deafening, nausea and vomiting, impaired coordination, paralysis. So those are some of the symptoms for CCI. AAI has pretty similar symptoms. So it has some of those same things, but then also you can have sensory defects, a neurogenic bladder, a lot of fatigue, jaw pain. So those are kind of some of the different ones. But when you have all these problems at once, it is pretty hard to tell, is my headache coming from instability at C1 and C2 or instability at C0, C1? So they just really kind of all go together for me. So like I mentioned, the imaging measurements for CCI that would mark your case kind of as pathological or needing surgery would be a Clivo-Axial angle of 135 degrees or less, a Grabb-Oakes measurement of 9 millimeters or more, and a Harris measurement of 12 millimeters or more. The measurements mainly used for AAI is the Atlantic Dens interval, or ADI, which is again a measurement between several places in your neck. This measurement of if it's 3 millimeters or less, it's considered normal in adults, and around like 4.5 to 5 millimeters is considered normal in children. So anything outside that range, so more than 3 or more than 4.5 to 5, could denote Atlanto-Axial instability. So to move into treatment for this instability, the options really are not great. There are some regenerative medicine options popping up. There are several places throughout the country that do them, whether it is prolobe therapy, PRP, or like stem cell regenerative medicine. Most of those are... I know there's one guy in Colorado who will do the stem cell therapy, the higher joints in your neck. There are some versions of the regenerative medicine that can't be done at the really high junctions in your cervical spine. So that's something I'm looking into for instability lower in my neck. I have chosen, it has not been recommended for me to do regenerative medicine, but I do have a lot of instability between C5 and C6 lower in my neck. And we're hopeful that the fusion between C0 and C2 will help stall that instability a little bit. But if not, I am interested in looking at regenerative medicine, since that is like a little bit lower in my spine. Besides regenerative medicine, rest can be an option. Bracing and rest are really not long-term solutions. I mean, I guess you could wear a neck brace forever, but I don't know how fun that would be. Obviously, really can't rest forever, so those are more like a short term to see how it helps you. There are some CCI experts who will use traction as not really a solution, I would say, but as kind of a test to see if a fusion would help you. Physical therapy is a really big option and a really great option for a lot of cases. I've been doing physical therapy for my neck for a long time. Unfortunately for me, it isn't making anything better, but I'm sure it's helping it from not getting worse. But kind of the most, I don't want to say popular or common or useful, I'm not really sure what adjective to use here, but a lot of times a fusion surgery is recommended. So for my case, my surgeon has recommended that I do a craniospinal fusion. So this would be where my joints in my neck would be fused together surgically to eliminate the instability, which would hopefully eliminate the brainstem and spinal cord compression. So I will be having from C0, or my skull, fused through C2, which would be covering the AAI and the CCI instability. Alongside that, will be having a decompression surgery for the Chiari malformation. I know there's some doctors who prefer doing both at the same time. They don't want to do one before another for whatever reason. I'm not sure what that is. But for my case, I'll be having the decompression and the fusion surgery together. So this surgery is a pretty major surgery. I would say it's a little bit controversial. Doing surgery on EDS patients is controversial because of our elasticity. It makes surgeries a little bit harder. So it's usually like an extremely very, very last option resort. And, you know, any surgery is controversial. You know, I don't know what the outcome could be, so I could go into this feeling kind of like here, and I could come out of it feeling way down here. So it's a real gamble, but I am looking at this as a preventative surgery. This is a degenerative disorder. Things are not going to just get better on their own for me. They're going to continue to get worse, and I'm already seeing the results of the spinal cord and brainstem compression impacting my life. So letting this go on for a lot longer could lead to more permanent paralysis for me. And, you know, one day I'd like to be able to pick up my grandchild without a neck brace on, or color a picture of her without my hands not working. So I'm under no impression that I'm going to go into the surgery and come out normal or 100%. But I'm hoping that it will at least dial back the symptoms from the brainstem and spinal cord compression and will give me some space for healing in the future that wouldn't happen absent that.